So, you just had a concussion. You're probably thinking, well, now what? I'm going to give you 3 at-home tips and tricks you can use to manage your concussion in the first 72 hours. Tip number 1, don't try to assess the injury on your own. Research shows that if you follow up with a qualified healthcare provider in the first 48 to 72 hours, you actually recover faster. Plus, Iowa state law requires you to follow up with a healthcare provider. Tip number 2, monitor for red flags. What does that mean? When you sustain a concussion, your first concern shouldn't actually be about a concussion. The first concern is actually to rule out more severe diagnoses, like a skull fracture. There are 2 ways that this is done. 1, follow up with your healthcare provider. 2, monitoring your red flags. Red flags include loss of consciousness, vomiting, inability to recognize people or faces, weakness or numbness in the arms, legs, or face, slurred speech, seizures, unequal pupils, and increased irritability or confusion. Go to the ER immediately if any of these occur. Tip number 3, relative rest. Sitting in a dark, quiet room is the old way of treating concussions, and we now know that can actually make things a lot worse. Instead, we want you to modify your activity by utilizing relative rest. It's okay to do things like read a book, have some screen time, play a game, do your homework, as long as it doesn't increase your symptoms. You should still avoid things like operating heavy machinery and driving, as well as strenuous physical activity like lifting weights and running. If you follow these tips and the advice of your qualified healthcare provider, you'll be on the road to recovery in no time. If you think you or someone you know has suffered a concussion, give the DMU clinic a call.